In this presentation, I am going to go over the IM injection sites. IM injection sites use underlying bony landmarks in order to locate them more precisely because around the muscles are major nerves and blood vessels. Therefore, we have to be very careful that we zero in on the muscle so as not to strike the nerves and vessels that are around the muscle. So to do that, we use the bony landmarks. Now, there are three intramuscular sites. There is the deltoid, which is an arm site. It is the upper arm. There is the vastus lateralis, which is a thigh site, and then there is the ventral gluteal, which is a hip site. In the past, we used to use the dorsal gluteal, which is more of a butt site, so that is more toward the back. But that site is no longer in alignment with evidence-based practice because it is close to the sciatic nerve, and there were a good number of complications associated with the use of that site that occurred when the needle struck the sciatic nerve. Many patients suffered nerve damage, both temporary and some permanent. So we should no longer be using the dorsal gluteal site. So let's begin with the deltoid site. So the deltoid is a triangular muscle, so it's an upside down triangle shaped muscle that is on the upper surface of the lateral arm. In order to find the deltoid muscle, we want to use the acromion process. So this is the bony prominence we're going to palpate for when locating the deltoid, and the acromion process is part of the scapula bone. So it comes around from the back of the body to the lateral surface of the upper arm, and we're going to feel a ridgy prominence at the very top of the arm. Potter and Perry tell us that the deltoid site is 1 to 2 inches below the acromion process. So the most straightforward way to landmark this site is to feel for the acromion process. We will put 4 fingers across the upper arm in this manner, with 1 finger on top of the acromion process and the remaining 3 fingers serving to measure that 1 to 2 inch distance. Now our site is right here. So find the acromion process, 1 finger on top and 3 to measure. Now if you have a particularly petite patient or you have very large hands, you can also use 2 fingers to measure, in which case you would feel for the acromion process, put 1 finger to landmark it and 2 to measure, and then we would be right underneath on the lateral surface of the arm. Okay, so the vastus lateralis is the leg site, and in order to find the vastus lateralis, we are going to locate the greater trochanter. The greater trochanter is the top of the femur bone. So it's kind of a knobby feeling process, top of the femur bone. So in order to be sure that we are not too high and on the pelvic bone, one trick that you can use is you can follow the inguinal fold, the groin fold, to the lateral surface of the body and drop down, and you should be then in the area of the greater trochanter. So you'll feel and palpate for it in that area. We want to go a hand breadth below the greater trochanter and a hand breadth above the knee when we're zeroing in on this muscle, and we are going to visually divide the area between our hands into 3 sections. The middle section is where we want to give the injection. The vastus lateralis muscle is on the anterior lateral aspect of the thigh, so it spans from the middle of the anterior thigh to the middle of the lateral thigh. Okay, it is anterior-lateral. Lastly is the ventral gluteal site. ventral gluteal is on the hip. In order to find this site, we have to use the hand opposite our patient's hip. So if we are going to give it in the patient's right hip, we know that we have to landmark with our left hand. So we are going to, again, go to the greater trochanter, but we also need to be pointed towards, with the index finger, we're going to be pointed toward the anterior superior iliac spine. So keep those bony prominences in mind. Again, hand opposite the hip, we find the greater trochanter in order to position our hand on the patient's hip. And so we find the greater trochanter, palm of the hand is on the greater trochanter, thumb is pointed to the groin, index finger is pointed to the anterior superior iliac spine. The remaining fingers are fanned posteriorly along the crest. The intramuscular site is in the V that is formed between the index and the middle finger. Now, with all of these sites, of course, we're going to palpate and make sure that we feel a nice sturdy piece of muscle there to give our injection into. To give you a better understanding of how these look on the body, I will just show you quickly on the mannequins how I would go ahead and locate these sites. First of all, the deltoid. For the deltoid site, we want to be sure that we expose the upper arm completely. We'll ask the patient if they're sitting up, we can ask them to bend at the elbow just to kind of relax the muscle. We're going to feel for that acromion process. 4 fingers across the arm like so. 1 finger is resting on the acromion process and the remaining 3 fingers are measuring that 1 to 2 inch distance below the acromion process, and then we are here. Okay? And then I will go to my mannequin in the bed to show you the vastus lateralis and the ventral gluteal. Okay, vastus lateralis. Again, that's our leg site, our thigh site. Okay, so we're going to feel for the greater trochanter. Okay, feeling for that bony prominence, palpate. Hands are going to be on the side of the patient's body, so we feel for the greater trochanter. We want to go a hand breadth below. Hand breadth above the knee, and then visually divide the area between your hands into thirds. We want to go into the middle third, okay? That will take us to the belly of the muscle. The other thing that we want to remember is that the vastus lateralis is on the anterolateral aspect of the thigh. So it spans, it goes from the middle of the anterior thigh to the middle of the lateral thigh. That's kind of the width of the muscle and the position of the muscle. Last but not least, we have the ventral gluteal site. So on this one, we want our patient to be on her side. Okay, and for the purposes of this video, I will not cover her, but certainly in a clinical setting, we would cover the patient as much as we could for modesty. And again, I want the hip flexed and the knee flexed like so. I'm feeling for the greater trochanter. Remember, using the hand opposite the patient's hip, left hip, right hand. I feel for the greater trochanter. Thumb is pointed towards the groin. Index finger pointed towards the anterior superior iliac spine. And The remaining fingers fanned posteriorly along the crest. The injection site is between the index and the middle finger in that V that is formed by those two fingers. Okay, so we again want to palpate for a good solid piece of muscle there. Okay? To be clear, our mannequins do not have bony landmarks. You will not feel the greater trochanter and the acromion process and so on. Also, we certainly have an advantage by seeing where the intramuscular pads are located. So we strongly suggest that you practice landmarking your sites on one another. There are a couple of beds in the nursing lab that have been emptied for that purpose. Also, if there is anyone at home that you can practice your landmarking on, that would be a good idea as well. That concludes this video. Thank you.